My name is Donna Richardson, and I'm the owner of Bossy Plans. Bossy Plans is founded to provide a welcoming environment for unique and spiritually curious individuals. Bossy Plans has offered metaphysical tools and accessories since 2019 to those who don't fit into one box when it comes to spirituality, and who are on a mission to forge their own spiritual journey based on what they feel and not what they've been told. Bossy Plans recognizes your spiritual path is a lifelong journey and everyone's path is unique, but you're the boss, so no one can dictate what that journey entails. It's your life, and you deserve to feel all the good vibes that life has to offer. Hi, I'm Donna Richardson, the owner of Bossy Plans, an online spiritual boutique. We offer a safe, judgment-free space for women of color and those who are on a journey of self-discovery. We brand ourselves on providing support to customers' mind, body, and soul through spiritual healing combined with ancient metaphysical tools and a splash of modern fashion. A non-traditional way to success and wholeness. We offer crystals, sage, incense, apparel, and so much more. If you love God, but curse a little bit, come check us out.
Working with Team Vision has been truly transformational for myself and my personal life, and then just, of course, within my business itself. I've been able to receive increased exposure from my company. I've generated several leads that I would have never thought otherwise possible, and in a very short amount of time. It has been beneficial for me to see the importance of marketing my business and getting the name of my brand out there and connecting with people who can now see me and understand what I'm doing in the industry of branding.
Hey everyone, good morning, afternoon, or evening, depending on when and where you're watching this live stream or catch the hashtag replay of this live stream. Welcome to our very first edition to Wellness Wednesday. I'm Kevin Williams, your host, and today on our show, we have the one, the only, Kathy Woods, who is an APRN, and she'll explain that to you once I bring on Virtual Welnness Healthcare. And let me bring her right on the show with me. Kathy, how are you today?
Hello, how are you?
I'm good, sis. What about
All right,
you?
brother.
So, Kathy, if you would, first of all, kind of share with people a little your background and like what do APRN stand for? You know, we got to get some clarity on that.
Okay, so my background is nursing. I went to the University of Arkansas at Fayetteville for my prereqs and finished up with my Bachelor of Science in nursing in 1989 from the University of Arkansas Medical Science, UAMS. And I worked on oncology in the medicine floor and then eventually moved to the intensive care unit. And 17 years into my career is when I decided, or I heard that small, still voice said, it's time for you to advance because you're no longer growing here. So I went to UCA to get my master's and got my Master's of Science and became Adult Health Nurse Practitioner. APRN stands for Advanced Practice Registered Nurse, and that's what APRN. A lot of people call us nurse practitioners, mid-level providers, you know, not a doctor, but you are a doctor and things like that. But we, as a nurse practitioner, we look at the holistic person. So we don't just treat your disease process. We want to treat your social and economic those things that concerns you. So we want to take care of the whole person, because if we have you on this really, really good medicine, but you're homeless, you're not going to really benefit from it fully as we would want you to. So that's what APRN is, Advanced Practice Registered Nurse. And that's what we look at, a more holistic view. Not saying that the medical doctor doesn't do that also, but that's kind of in our background, or as some people would say, in our DNA to do that.
Okay. And what are some of the credentials that you currently hold?
I am the Master's of Science. I'm credentialed through American Academy of Nursing Credentialing for my national certification. I have been credentialed in HIV specialty. I have been credentialed in substance abuse, and I have been credentialed in stroke.
Okay. So today I want us to talk about diabetes. A lot of us are not aware, and a lot of us may be aware, but we're not necessarily educated on diabetes. So first of all, share with the viewers like the types of diabetes.
Okay, as everyone knows, there are what they call two types of diabetes. Really, it's three types of diabetes. There's type 1 or juvenile diabetes. There's type 2 diabetes, and then there's gestational diabetes, and that's when a lady who is pregnant become diabetic. But most people know type 2 diabetes because it's the one that everyone's talking about, and they say it's related to lifestyle, but it can have some genetic factors. And type 1 diabetes is what we call juvenile diabetes, or it's just when your pancreas doesn't create enough insulin to control your blood sugar.
Okay. And so in those scenarios, like I know it deals with, our blood sugar. So kind of, explain to us some of the, not the word, what are some of the awareness that we may be experiencing, but not know that that's a sign of diabetes?
Okay. So for instance, let's say that you are just thirsty, but it's 90 degrees outside. So you can explain you being thirsty to it's hot outside. But let's say that you're thirsty and then all of a sudden you start using the bathroom a lot. And then all of a sudden you're just hungry, and all of a sudden you just don't feel well. You got blurred vision. Where you go to your doctor and they do an A1C and they see that your A1C is like 7 or 7.5. Well, that is one of the keys to say that you are type 2 diabetes. So those are some of the signs and symptoms of type 2 diabetes. For type 1, a lot of times they have nausea and vomiting, and they are just they're hungry, but they're not gaining weight. That's because the pancreas is not creating enough insulin to regulate their blood sugar.
Okay. And so if your blood sugar is low, what does that mean?
If your blood sugar is low, and no one like low blood sugar. That's why a lot of people who are on medicine say, I don't want to take too much medicine because I hadn't eaten and my blood sugar gonna drop, because no one like that feeling. You get real irritable, you get nervous, you get confused, you start getting shaky and sweaty, and you know that your sugar is low. And if those things happen, you can eat some hard candy, eat a tablespoon of peanut butter, but don't drink a diet soda, because even though we feel like the diet soda is sweet, it has no sugar in it, so it wouldn't do you any good.
What would happen if you were to drink a diet soda?
Your sugar will still be low, and you'll still have those symptoms, and then your sugar probably even get lower.
Okay. Now, a lot of people say that your diabetes can be cured. Is that a true statement or a false statement, or it just depends?
It really depends, because I've had a lot of people who, once they've been diagnosed with diabetes, they get very serious and they take their health very seriously, and they have type 2. Now, type 1 diabetes, if your body is not making insulin, the only thing you can do is use insulin, either through injections or continuous through the insulin pump. But you type 2 diabetes, it's a lot of times related to lifestyle. So let's say that you start getting active and start walking or running or start doing cardio, let's say that you start backing off on those carbs and you lower your portion size, you lose weight, you can bring your blood sugar into a regular level, and you can come off the medicine. Now, when you still have diabetes, it'll still be underlying, and you're gonna have to keep it under control. But you won't need medicine. You'll be a diabetic whose blood sugar is controlled by lifestyle changes.
So are you saying once you're a diabetic, you're going to always be labeled as a diabetic?
I think that's what the medical field is saying,
Okay.
and especially your insurance company.
Okay. But so what are some things that could cause type 2 diabetes? I mean, like
the one of the main things that I see is what we call central obesity, and that's having the larger stomach or GERD. That can be an indicator of that you may be at risk for diabetes. Another thing is that you're overweight. Another thing is that you're thirsty all the time and you just don't know why, or that you're having blurred vision. So those are some things that can indicate that you are tipping over into diabetes.
Okay, so let's just take someone that's in denial, and they may say, I'm not diabetic. So if your legs are swollen, is that an indicator?
It could be an indicator of a lot of things.
Like what?
Mainly that your kidneys are not working well, or that you're retaining fluid. So it can be an indicator of a heart failure. It can be an indicator of a lot of things with swollen legs, a blood clot, or things like that. But if your medical professional has diagnosed you with diabetes and you're in denial, nothing is going to help until you accept it and move forward with it. And just because you have diabetes does not mean it's the end of the world. It just means that you need to make some lifestyle changes, and that you're going to have to take some medicine to help control your blood sugar.
If you don't control the diabetes, how can diabetes spread what other areas could it spread into?
Well, diabetes can cause heart disease.
Mm-hmm.
Diabetes can cause blindness. Diabetes can cause decreased blood flow to your toes and your feet. And that's why you see a lot of people who get amputated toes and things like that, because of poor circulation related to the diabetes. Diabetes, the sugar is so thick in your blood that it's like molasses. And once it hit the kidneys and the kidneys can't filter it, it's another reason why you may end up on dialysis. So diabetes has a lot of severe consequences that you need to consider and really want to keep your blood sugar under control.
Is diabetes more prevalent in the Black community or Hispanic community or the white community?
Well, I personally think because of health disparities that we see it more in the Black and Brown community. Not saying that it's because we're doing something wrong. It's just that we don't have sometimes we may not have access to medical treatment. Sometimes we may not can afford the best medicine to control your blood sugar. Sometimes we don't have time. We don't make time to go to the doctor and do preventive care. We go to the doctor when we're hurt or something is wrong, but we don't go to the doctor for our preventive care, like colon cancer screening, breast cancer screening, prostate cancer screening, getting a yearly exam to see where your sugar is, how your kidney function is, and everything like that. So I think that not that it is more prevalent in Black and Brown communities, but I think because of the other factors that go along with living life may take a precedent over you taking care of yourself and your health.
What are some meds out there that is typically provided when you have type 2 diabetes?
For type 2 diabetes, sometimes, we try to start you off with an oil agent like metformin, glyburide, and we try to do that. Well, a lot of people can't take metformin because it can upset your stomach, and who wants to take medicine that's going to make you feel like you got to throw up all day? So we may have to go to something like Januva or Jardiance or something like that. And if none of those work, or if your sugar persists on being high, we may have to put you on insulin, and then you have to take those insulin shots.
And how often does someone have to take insulin shots?
It just depends on how well you control your blood sugar and how well the insulin works for you. Most of the time, most people take some insulin like Lantus or Levemir once at nighttime, and then some people may have to take an insulin like NPH twice a day.
Okay. And then tell us about the virtual clinic that you all have.
Okay, so Virtual Wellness is a after-hour telehealth and on-site clinic that is operated by 5 APRNs, and we see patients either through telehealth, and you can go to our website to schedule an appointment, or we see patients on Thursdays from 5 to 9 and every third Saturday. And you can go also to the website and schedule in-person visit. It's to help people who have an issue or don't have a PCP and want to come to the clinic after hours. Because like I said, sometimes working and providing for you and your family and your household take precedence over going to a doctor. But if you can go to the doctor after you get off work, that will help out a lot too. So we want to reach those people who need healthcare but can't do it between 8 to 5. Or let's say that you need to see your primary care physician, but they don't have an appointment for 2 or 3 months. You can come to us and we will refill your 30-day supply of medicine depending on the circumstance. And that way you're not taking your medicine. So we're just here to try to stand in the gap for people who need healthcare after hours.
And what are the, what days of the week are you all providing this? Is it 5 days a week, 7 days a week? What?
It's Monday through Friday, from 5 to 11 for telehealth. And like I said, every Thursday from 5 to 9 on site, and every third Saturday on site from 8 to 12. Also on Saturday, we do telehealth from 9 a.m. to 10 p.m.
Okay. And do you all accept insurance, or is it private pay, or what?
We accept most major insurance. We continue the process of getting credentialed through most of the major insurance company, and you can always pay the flat fee of $75.
So it's $75 no matter what the situation is.
Let's say it starts at $75.
Okay.
But most of the time it's $75. But yeah, you come in there and you a train wreck, it may be a little bit more, but for your basic initial visit, $75 flat fee, or we bill your insurance.
Okay, and then you mentioned is you and 4 other nurses or 5 other nurses?
It's me and 4 other nurse practitioners.
So what are their specialties?
Lynn Frazier, she is acute care, and she is really known for the treatment of hepatitis C. Irma Storray, she's adult health, and she's really known for the treatment of hepatitis C. Also, Marilyn Frazier, she's family, and she's also known in the community for maternal health and women health. And Sharonda Randall, she is she's family, and she also take care of individuals and children.
So each one of you all have a different role that you play within the clinic, then, right?
Yes, we do. We bring it all together for the best care that we can provide for the patient.
So, all right. So let me ask you this, Captain. So just kind of do a recap. Like, give the 4 or 2 to 4 indicators that you may have diabetes.
Okay, so the most common ones are excessive thirst, excessive hunger, excessive urination, blurred vision, and just not feeling well, fatigue.
And the fatigue comes from what? Because you constantly being thirsty, or what?
It's just one of the symptoms. It's come from having such a high blood sugar that your body is working so hard to try to bring your blood sugar down that it's tired.
Really?
Yes.
Okay. And then how once you make the appointment, like what's the next steps? You make the appointment, you come see the primary care person. Like, what's going to happen next?
So let's say that you not feeling well, that you notice that you're really thirsty, that your vision is just blurry. So you make your appointment to see your doctor or your nurse practitioner or your healthcare provider, and they'll do some labs. They'll check your blood sugar right there in the office. Let's say they check your blood sugar and it's 310. So we already, that indicates that it's high. Then they'll check your urine, and then you got glucose in your urine, another indication that there's something wrong. And then they'll check what we call a hemoglobin A1C, and your hemoglobin A1C is 10. Those three factors right there are label you as a diabetic.
And so once that happens, how often should you come in and get your A1C checked?
Every 3 months. Every 3 months until it's stable or less than 6.5, and then every 6 months.
And then if it's less than 6.5, do you still got to do every 6 months, or?
Yes, that's the recommendation from the American Diabetes Association.
All right. So, Kathy, any last piece of information you want to share with us?
No, the most important thing I would like to say is preventive care is much more important than treatment. So if you can get in and get your screenings, your colon screening, your cervical cancer screening, your prostate screening, your breast cancer screening, get those things done yearly or however often is the recommendation is, so that you can get ahead of this curve and, get active, start walking, start doing something just to move your body, because exercise and nutrition plays a big part in your health and your longevity.
Yep, I'm in total agreement with that. Kathy Woods, APRN with Virtual Welnness Healthcare. We will be putting their website in the link bio, so you can have an opportunity to schedule an appointment with them. And again, guys, our goal is to bring wellness awareness as many Wednesdays as possible. So be on the lookout for our next Wellness Wednesday. And again, the goal is to educate, equip, and empower the community when it comes to wellness. Thanks again, Kathy.
All right. Peace.
I'm very thankful that not only has Team Vision taken on my personal business growth, but they also continue to give me tips outside of just the services that they provide. For me, that's not only building trust within the relationship, the business relationship that we've established, but it's also helping me to see that there are marketing companies out there that truly do care about the success of your company.